Thank you.
Don't run without looking ahead. That's the lesson.
It feels like these are almost designed to go together. So, Pananda, good afternoon. My name's Tim Smith. I'm Business Manager for the Powys Living Well Service. We're part of Powys Teaching Health Board. We're based in the middle of Wales. In terms of size, we just heard about a practice of 20,000 people. Our health board has got a population of 135,000 people. We cover a quarter of the landmass of Wales. So it's an area of around 2,000 square miles, which thankfully Google reassures me is 3 times the size of Greater London. The kicker is we don't have a district general hospital of our own. We have to work with everybody else around us to provide that kind of inpatient care. So if I ask you to picture a barrier to healthcare, you're probably going to think about some of the disjointed systems that you've heard about earlier today, think about waiting lists, thinking about workforce shortages, thinking about funding pressures. Actually, for us, the biggest barrier is geography. For many people in the county, healthcare appointments involve an average round trip of about 37 miles. Now, Living Well Service is a long-term condition service and supports people with persistent pain, chronic fatigue, long COVID, severe overweight and obesity, weight management issues. If you're experiencing one of those conditions, 37 miles out and back isn't just inconvenient or slightly unpleasant, it's bloody horrible, frankly. It can be exhausting, it can be expensive, it can be incredibly time-consuming, and sometimes just the thought of that 37-mile round trip is enough to stop care before it actually gets started. And that's where our story as a service begins, not with the technology, not with a platform, but with a simple question. How do we bring that care closer to people without leaving anyone behind? And our idea was not to choose between digital care and human care. It was to redesign the care we provide around real life, addressing how to use the technologies that we've got to support people. And we started with the practical barriers that people were facing. So for some, it was the lack of a suitable device. For others, it was poor connectivity, perhaps low confidence, anxiety about using technology, disabilities, or just simply not knowing where to start. And we put together a package of practical support built around the person, hence the whole idea of this citizen-first, person-first approach. You can tell I work in secondary care because we're not talking about patients, we're talking about people. So we developed device loan arrangements, working with our local authority, our library services and other community partners, making sure that we had access to devices, making sure that people had access to connectivity, not just any connectivity, but affordable connectivity, where we can, free connectivity. And the one that I personally think is probably as important as the other two, but tends to get lost, is access to safe local spaces to actually be able to use the technology. Recognising that not everybody has a home environment where it's actually easy or straightforward to have a virtual consultation or even a telephone call with a medical professional. We work with third sector partners to provide even more tailored support. So we've got access to a team who go out and help people in their own homes where that's the most appropriate option. And they look at specific technology solutions that will work for individuals. We've also developed and we host our own e-learning and flexible support resources so that people can access support in their own time, in a way and at a pace that actually works for them. And crucially, we've introduced the role of digital facilitators to the service, not just to fix technical problems and to troubleshoot, but to sit alongside people, whether that's virtually or physically, whether that's people, citizens, or clinicians, offering one-to-one support, building their confidence, troubleshooting barriers, and helping people to engage with care in a way that feels possible to them. And it's made a huge difference because it means now that when you get to the consultation stage, clinicians can actually focus on the message rather than the medium during their appointments. They can focus on giving people the support they need to be able to manage their health and well-being effectively. The clue's in the name, Powys Living Well Service. So today, how has that worked out? Over 90% of our service user contacts are delivered virtually in some form. We've supported hundreds of people to get access to device loans. We've provided enhanced support to dozens of individuals, particularly those with disabilities across the county. And we've seen lower missed appointment rates. We're regularly hitting now 3% DNA rates, shorter waiting lists, and better use of face-to-face appointments for the people who actually need to be seen face-to-face and need that contact the most. So for me, the most important thing is this. Digital didn't become the point of the exercise. People stayed centre to the whole process. When digital support is designed around people's real lives, it does more than just modernise a service. It reduces wasted journeys, it widens access, it protects individual choice, and it makes care feel closer, fairer, and importantly, more human. So the lesson we learned in Powys is simple. Digital transformation is not actually really about digital. It's about whether we're willing to redesign services around the lives that people actually live. And when we do that well, technology doesn't distance care from people, it helps bring care to them at home.